charged another professor. You're going to come up or you're going to stay? You're going to come up. GP Li, who is another Southern Californian from the University of California at Irvine. He works in 3 departments, but you can explain it better than me, so take it away.
Okay. Thank you. Before I start commenting on what I have heard today, I'd like to take this opportunity to thank Organization Committee for inviting me. I am not an expert in this field, although I have been working on this in the last 5 years. And I can tell you, wow, I really wowed by all the presentation I heard today. I learned so much from it and really make me inspired. A lot of things we can do working together as a team. And we can bring a solution to the people who need the technology to help improve their quality of life. At the same time, reduce the cost of the care. I do believe so. But what I've heard today is I can divide them into 2 categories. One is related to the empowerment technology, empowering health with technology. The second thing is about how do we really get the technology to the hand of the users. I have not heard from today's conversation is entrepreneurship. How do we really get the solution to the user, to the markets? So that's why I'm going to talk about today in this comments is fall into that 2 categories. First one is I heard today about the technology. The empowering health technology means empowering individuals to live independently and to take an active management of their own care and also their own wellness with technology. And this is really a paradigm shift to me. In the past, we know the healthcare is done by top-down. It's led by physicians, by caregivers. And with the technology, we enter a domain. Empowering individuals is a bottom-up approach, very similar to the internet we are experiencing right now, bottom-up approach. The producer and consumer can be the same person. That is an excitement to me. And as a result of using this type of empowerment technology, I do believe it can potentially lead to a paradigm shift in healthcare. It's 5 areas, so-called preventive medicine, predictive medicines, and personalized medicine, and participatory medicine, and lastly, palliative medicines. Because of the technology, really level of the playground, and it can tailor individuals' needs. That's what I see by hearing from today's presentations. And second thing is, what I heard today is the technology, it reaches some kind of a convergence in 3 categories. The first one is the healthcare technology we heard this morning, and in the afternoon is related to the information and communication technology. The third one, I think is the most importantly, is consumer technology. When we reach that domain of a convergence, consumer, what does that mean? The technology has to be affordable, accessible, and portable. That is very critical because that is what user needs. When we think about the aging into disability or aging with a disability, technology is for all of us. It's not only for that specific group. So when we think about the technologies for consumer, for all of us, including myself, I think that is the concept we have to really think about. Technology is not just for the specialized group. And third thing is related to the long-term effectiveness of the technology. I heard a lot of conversation about this topic, and I think it's a key thing here is how do we motivate the user to continue using technology? I use myself as examples. New Year resolutions, I need to be fit. I want to exercise. I bought a stationary bike. It has all the bells and whistles, has all the information I need, not just data, information, and tell me how healthy I am. Guess what? After 2 months, where is it? In my garage. But why it does not motivate me? Right? So when we think about consumer technology, has to really keep that in mind. That is very important when we design the technology. As a result, it can lead to the long-term impact to our health and health management and motivating us to be healthy. So related to the personalized medicine, what I heard today is in both ends. One is in the physical world, personalization, And second thing is related to the virtual world personalizations, right? So the data accessibility, information accessibility, as well as the device accessibility. That is to personalize individualist experience in using technology. I think that's very critical. And that is something we have to think about so that it has the long-term effect on the use of the technology. So related to the entrepreneurship, in this health management and so on, I ask myself a question. When we drive around in the city, how many toys and arts we saw? Many, many of them. But have we seen any technology for all of us? Are we just think about kids? Why don't we design technology for all of us? So I try to challenge all of us. Can we have a new store? It's ET and us. ET means empowering technology, empowerment technology, or ET for home is for all of us. Right? And with that technology, what we can do is now you can use a different venue to bring people to the arena to really think about how to use the technology and how to help them to live in a quality of life. Right? So what I see here is in the entrepreneurship, there are two ways to do it. One is a business entrepreneur. The other one is a social entrepreneur. So how can we do it? So we think about for the social entrepreneur, they are inventors, innovators in technology. And we can work with the foundation, work with community centers, work with fitness centers. They are different venues to deliver, to render the care and wellness to the people who need the technology. Right? With a very minimum cost. I think that is a way we have to think outside the box. How to reach out different venues to really get the solution to the markets. And for the business end, the business entrepreneur right now, because this is a really complex problem and involving so many different sectors of a business. And what I see here is opportunity very similar to one industry I know of, is energy efficiency. Right? So we know in our nation we're facing one of the major issues related to the environment, and we need to reduce the energy consumptions. So there is initiative in coming up with green energy source as well as to improve energy efficiency. So how do they do it? There is a so-called government program, volunteer program, Energy Star. Probably you have heard about that. When you purchase appliances, there's a label Energy Star. When you see that, you know it has a certain feature in terms of saving the energy consumptions for their appliances. So since we are talking about this, the technology for the health, wellness, and so on, and it's coming in the consumer level. So if we can come up with sort of a Energy Star equivalent program as a volunteer program without verifying every technology is working, we can bring the technology to the market, let people try it out. Right? And if the technology has been verified and studied by the researcher innovators and by the NIH program and so on, FDA approval, they have different labels. Right? So the question is that if we keep waiting for all the verification by experiments, that would take too long. That's why we say it takes about 2 to 5 years for medical devices and 10 years for the drug developments. We have to shorten the cycle. So how do we do it? We have to come up with a different approach, entrepreneurship approach to solve that problem. And that's why I see that is opportunity for us to think about how to really come up with a program for that. And that is something I would like to challenge this community to engage the consumers and also ask ourselves to come up with a mechanism to do that. Thank you.